Huw Irranca-Davies.
Minister, could I turn straight away to the NHS Covid-19 app? Could I ask, first of all, are there similarities with the system being used in Scotland, where, for example, the QR codes are on every table and every counter and every bar and every restaurant? Very easy, very convenient to use, and I have to say everybody that I observed when I was there recently was using it. What proportion of the population need to actually update this and use this for it to be effective? And how do you promote that update, not least amongst the young and those who are big data skeptics? And can you confirm that this is in addition to, not replacing, the old school, tried and tested, localised test and trace protect taking place in Wales? And just finally, what's your very simple message to the people of Wales about how why they should use this app? And if you can't answer all of these in detail now, just write out to members and we'll pass it on to our constituents. Thank you, Minister.
Thank you to the member for the questions. I'm happy to confirm that the NHS COVID app is now done on a local, not a central basis. That was one of the concerns about privacy, so it should be largely resolved. So this is the second round at running an app, and while Scotland and Northern Ireland have a proximity app that tells you how close you've been to other people, the app that England and Wales are going to launch and use together actually provides a bit more functionality than that. And actually it made more sense for us if the app worked in England for us to have the same system, because obviously the transfer to England and Wales, a very porous border, actually having a similar system has real practical advantages to it as well. Interestingly, as well as a proximity app, it also has a diary function in it as well. So if you have downloaded the app and you've been using it to check into places, you don't need to remember what you've done, because there'll be a function on your phone to allow you to do that. And so there are real advantages, and we've encouraged businesses to download QR readers to make sure that people can check in and check out as they're going around into different venues and businesses. And it's particularly important. It's going to launch on the 24th of September. That's the plan, because we want to have this in place ideally before university students return. They're one of the key target groups who are likely to use and download the app, and somewhere where actually the challenge is about people being mobile. It'll be much easier to do that, particularly where people are moving to potentially a new environment. And in terms of your question about this as an add-on, it is an add-on. So contact tracing is still effective in Wales, highly effective. 98% of our index cases, people with a new COVID case, get successfully contacted, and overall, since the 21st of June, 94% of their close contacts have been contacted as well. So very high success rates, and real credit to our staff. So it's an add-on to that, but it would be a useful add-on, and I would encourage people to download the app, and we will be providing more information to members and the public as we move into the phase of finally implementing this across England and Wales.
Thank you very much, Minister.